It is that time of year, cold and flu season. Everyone seems to have the sniffles. What would you like to know about ears, nose, and throat problems, ranging from scratchy throats to hearing loss and other ears, nose, and throat problems? Good evening and welcome to Doctors on Call. I'm your host, Dr. Ray Chistensen, from the Department of Family Medicine and Biobehavioral Health at the University of Minnesota Medical School, Duluth. I'm pleased to welcome our panelists this evening, Dr. Todd Freeman, an ENT Specialist with St. Luke's Ear, Nose, and Throat Associates, Dr. Jonathan Glickstein, an ENT Specialist with Essentia Health, Duluth Clinic, and Dr. Addie Licari, a family physician with St. Luke's Mount Royal Medical Clinic. We'll be taking your questions at 218-788-2844 or toll free at 877-307-8762. Our medical students answering the telephones tonight are Ryan Kolakovic of Mankato, Minnesota, Rachel Hewer from Lester Prairie, and Peyton Schultz from Hamburg, Minnesota. Before we start on tonight's program, I want to just take a moment and thank Dr. Ruth Wester for her many years of hosting this program, a program that's been around for about 35 years. It was really great having Ruth as one of our co-hosts. She has done so much for us in rural medicine, VA care, and also at the medical school. She is now exploring a new business, a new job, retirement. So we'll see how that goes for her, but we wish her the very best. So tonight's program, we'll move on to our problems with ENT. First of all, Dr. Licari, do you want to tell us a little bit about your practice and yourself?
Sure. So I have a full spectrum family medicine practice in Duluth, near the university. I still see patients in the hospital as of now. I still see nursing home patients, and I deliver babies. So we basically see patients from birth to the grave, and I love it.
Dr. Glickstein?
Yeah, good evening. So I practice at St. Mary's Essentia Health in Duluth with a couple of outreaches to Superior, Hayward, and Spooner in Wisconsin, and practice full general otolaryngology practice.
For those of us from the rural area, thank you for coming out.
You're welcome.
Dr. Freeman?
Yeah, I've been here for 26 years with my partner, David Choquette, and practice with St. Luke's system and see patients in Grand Rapids, Moose Lake, Cloquet, in addition to Duluth.
And likewise, we appreciate that you do that. So we'll start with the flu. We're not going to spend a lot of time on the flu. I think it's been talked about an awful lot on the news. But here in Duluth, Dr. Licari, you're on that front line.
Yeah.
Do you want to tell us a little bit about what the flu is and what it's been like in your office?
So the flu is a virus, or a series of different viruses, and we're actually seeing a huge sort of influx of flu cases as of the past, I would say, 3 weeks. Our hospitals are full of patients who have medical problems and have complications from having influenza. We're also seeing, sort of on the outpatient side of medicine, a lot of people coming in with flu symptoms. The biggest flu symptoms are headache, myalgias, or muscle aches and pains, high fever, and we're seeing a lot of high fevers even in adults this year, as well as sore throat, cough, runny nose, and at times secondary things like pneumonias or ear infections related to that.
What kind of things can you do for treating the flu in your office?
Well, it sort of depends on who you are. If you're a uncomplicated, very healthy patient who is not a young child, oftentimes all you need is rest and over-the-counter medicines to make you comfortable, and plenty of fluids and chicken noodle soup. And you really don't necessarily need to even come in and expose everyone else in the clinic setting who may not be as healthy as you to influenza. People who have chronic medical problems, who are very elderly or very young, those are the people we do want to see, and we do want to consider treating with antiviral medication, Tamiflu, in order to shorten the duration of the virus and also to reduce the symptoms.
Yep, thank you. I suppose some of the complications, pneumonias and things like that happen, and that's where the hospital comes in.
It is, and we've actually seen quite a lot of people actually die from the flu this year. And that's what is scary, and what's in sort of the media right now is
But it's still important to get the flu shot because it
really
does offer
important.
protection.
Yeah, it's really important to get the flu shot, and I'm sure you've heard people say, oh, the efficacy is this or this, but really you're vaccinating against a virus that is related to all of the other influenza viruses, and so you actually get not necessarily immunity, but you tolerate the illness much better if you've been vaccinated, and you also don't spread it to people who potentially could have complications from that.
And the other things, of course, is cover your cough, wash your hands,
Mm-hmm.
and there is efficacy with chicken soup. At least I've read that there is. Where are
There's
you
a
on that
couple
one?
studies on that. I mean, my advice is drink plenty of fluids and eat what you can if you feel hungry.
So what's one of the other complications, I suppose, or complications that can happen, let's move up into the ear, nose, and throat area. Sinus infections. Let's start in there. What is sinusitis, Dr. Glickstein?
The basic premise and definition of sinusitis is that there's inflammation within the air spaces in the face, which are the maxillary sinuses in the cheeks, the sinuses in between the eyes called the ethmoid sinuses, and the frontal sinuses above the eyes, and then a pair of sphenoid sinuses sort of in the geometric center of your head. And the inflammation can lead to pressure, discharge, and all kinds of other symptoms. And it can be related to an acute infection, which can either be viral or bacterial, or it can relate to long-standing sort of inflammation for a variety of reasons.
Dr. Freeman, this is one of those hard questions. My dentist always reminded me that what's one man's ceiling is another man's floor. How do you tell the difference sometimes between sinuses and teeth?
Yeah, sometimes it's not easy to do that, and the picture can certainly get blurred, but because dental issues can certainly cause sinus pain and vice versa. But the typical symptoms you think of with sinus disease are midfacial pain or pressure, nasal obstruction, and rhinorrhea or drainage from your nose. If you don't have any of those and you have some tooth pain along with midface pain, then it's probably a tooth. But if you have other symptoms, then you certainly have to consider the sinuses as a possible cause for dental pain.
In talking with Dr. Licari earlier, I understand that you're the expert on plugged ears.
Oh yeah.
So well, it's good because we have a question. This person's had plugged ears for 1.5 to 2 weeks, and the question that this person has is it because of the flu? His or her doctor said it might be. Do you want to talk a little bit about plugged ears and why that goes on?
Yeah, you can get plugged ears from Eustachian tube dysfunction. Now, that's a tube that ventilates the space behind your eardrum from the back of your throat behind your nose, and certainly flu or upper respiratory tract infection or allergy, anything that causes irritation in your nose can make your Eustachian tube kind of go on the fritz. And the real question with someone when you have plugged ears, is it just pressure problems or is there fluid there? And the way to kind of sort that out for yourself is if you actually have some hearing loss with the plugged ear, then you may have fluid. And if it's just stuffy ears without much for hearing loss, then it's probably just that negative pressure. The fluid, if you don't have fever and it's not painful, it's just stuffy, that's something we just tend to follow conservatively. And it can be present for up to 3 months and still be considered normal. Once 3 months passes, then it's certainly time to intervene.
Dr. Licari, what kind of things do you do in the office for the plugged ears?
Well, I mean, sometimes it's just time. Because we do know that even after an ear infection, you can have fluid or a plug type feeling in your ears for 2, 4, even 6 weeks at times. It's one of those things that's probably fairly hard to treat, to know exactly what to use, but we try things that would reduce the swelling of the adenoids, which are right at the exit point of those Eustachian tubes. So nasal steroids or nasal sprays such as like Nasacort or fluticasone is another name we will use. And you have to do those every day for a period of time. Otherwise, I do recommend at times, if people are really quite severe with their symptoms, using antihistamines or considering a short course of a decongestant. But those really have been kind of mixed with regards to clearing up that problem.
So long as we're on the ears, Dr. Glickstein, tell us a little bit about earwax. And it's okay to use Q-tips to kind of clean those out?
Earwax is a natural product that your ear makes, contrary to the cotton tip applicator sellers. It is not dirt. It's actually good for your ear. It can provide a mechanical barrier for things from entering into your ear. It actually has some antimicrobial, antibiotic properties. And I'll be honest, it's best left alone. There are very few people who require having their ears cleaned, either in primary care or in an ENT's office. And those are typically people who have an underlying skin condition in their ear, or perhaps are just unlucky enough to have extremely dry or hard wax. It's best left completely alone.
Todd, what makes a person's nose drip?
Well, there's a lot of different causes for a runny nose. I think the one we see that is most frustrating is particularly in people as you get older. You get into your 50s, 60s, and beyond, and you just develop this. People can develop this chronic, draining, runny nose that's clear. They don't. There's no seasonal variance. It's unpredictable, and we usually call that vasomotor rhinitis. And we have limited things that can help it, but there are a few. The nasal steroid sprays that Addie mentioned earlier can help. We have a medicine called Atrovent that can help that. Or sometimes we have topical antihistamine sprays that can help that chronic, clear, runny nose that just doesn't seem to vary with seasons.
So a person calls in wondering about what is a web in the throat. I'm not sure where that comes from or what that is. Do either one of you have thoughts on that?
They may be referring to an esophageal web,
Web?
which basically is a narrowed area, possibly caused by scarring, but also possibly developmental if it's in a child, where the opening in the esophagus, the tube did not open or form correctly. And sometimes if it's there, it could be treated or stretched or removed in some way, but it's kind of hard out of context to make any recommendations on it.
Occasionally we see webs in the airway as well. Usually they're complications of people having been intubated and on ventilators or breathing machines for prolonged periods of time. They're not real common complications. It's nothing we see with great frequency.
Addie, tonsillitis,
Yes.
strep throat.
Mm-hmm.
What is that?
So strep throat is a group A strep infection that is becoming, sort of resides in the tonsils and starts to cause inflammation and swelling of the tonsils. And your tonsils are right on the side of your airway, and so it becomes not only painful, and you can get high fevers, rashes, stomach aches associated with strep throat, but you can also, actually carry strep. Be a strep carrier and have this bacteria in your throat, but not necessarily be.
So when they say cryptic tonsillitis, what does that mean in your mind?
So essentially cryptic tonsillitis is that you have crypts or big crevices in your tonsils, and you tend to collect things, secretions, stones or liths, which are pieces of digested food, proteins from salivary glands, and people often knock the things out of their tonsils. They'll develop inflammatory reactions at times to these materials that accumulate in these tonsils.
So gentlemen, this is a 22-year-old young woman who has cryptic tonsillitis. She's had several sore throats. And this kind of a lead-in, it's been recommended by her physician that she has her tonsils removed. Do you want to talk about tonsillectomies and when and if and how, and whichever one of you wants to start with that? You can do it together.
Sure, yeah. So tonsillectomy as an adult should not be taken lightly. Coming from someone who
And one of the questions was, what are the risks?
Coming from someone who had it as an adult, it's quite a painful experience, but if done for the correct reasons, can be quite beneficial for the patients. And I can think of one person that I think of who afterwards said, I wouldn't do that again. But the vast majority of people who actually go through with the surgery, despite the difficult recovery, are happy they did. Someone who has chronic tonsillitis or chronic inflammation, sort of ongoing irritation, pain, tonsillitis, may very well benefit from having their tonsils removed if this has been something going on for years and the symptoms that they have, the patient believes really warrant going through that recovery period. For the most part, I kind of let patients, after outlining the surgery and the recovery, let them more or less make that decision.
And in that setting, in that chronic tonsillitis setting, unlike recurring acute tonsillitis, we don't worry too much about, or you don't have to be too concerned, this person doesn't have to be too concerned about complications arising as a result of this chronic low-grade tonsil inflammation. So they don't have to take them out for fear of, post-strep kidney failure or recurring abscesses or valvular heart disease or any of the reasons why we really get aggressive with a lot of frequent strep infections. These people are doing it for comfort, and they just have to come down to the conclusion whether it's worth it for them to go through 2 or 3 weeks of misery to be done with potentially years of low-grade discomfort. And it's just a personal choice this patient will have to make for herself.
Is there an age where you're too old to have them removed?
No, because we'll take tonsils out of patients occasionally, especially even very elderly people, if they're asymmetric, or especially if one feels hard for fear of a tumor.
Mm-hmm.
But those patients don't like us very much for a while.
Peritonsillar abscesses.
Well, those are one of the few, I would say, urgent, if not sometimes emergent diagnoses that we happen to see, both in the clinic as work-ins and in the emergency room at night. And basically, it's an infection that has spread from the throat and from the tonsil deep to it, and can get into space inside your throat where it accumulates pus. It's extremely painful for patients, and it does require drainage, which can be done either in the clinic, in the emergency room, or in some circumstances in the operating room under general anesthesia.
And once it's drained, it feels pretty good once you get it out of there.
Yes, generally so.
Addie, can you use hydrogen peroxide to clean out ears?
Well, you certainly can use anything to clean out the ears. It's a matter of whether you need to or not. So oftentimes when we're cleaning ears that need impacted wax removed, we will use plain old tap water. We actually use a laxative at times to soften the earwax. You really just have to use something that's going to be pretty benign and not harmful to the skin and the mucosal tissue of the ear.
I never thought about the laxative.
Yeah.
That works pretty good.
Mm-hmm.
Good deal.
But my biggest advice for people who tend to get a ton of earwax or have to come in for frequent impactions is just, if you don't have any reason not to, let the shower run in your ear when you shower, and that helps remove some of the dirt and debris and other things in the ear. And the ears actually should be designed so if we lay down or if we stand up, they should drain and not necessarily retain water.
Should this person be concerned because they can hear their pulse in their right ear? And we can go right down the line because there might be different thoughts along this.
I think
Addie, let's start with you.
It depends on context, and I was actually asked this twice today already, and it's a fairly common thing. People who are stressed, people who have anxiety, people who are sitting up at night trying to fall asleep, often in certain positions will hear the internal carotid pulse in their ear, and that's a very normal thing in most people because of the proximity and just that, anatomically that can sometimes happen. Patients with very high blood pressure who are at otherwise higher risk for stroke or other things, we worry about that, but it's not, if someone comes in and tells me they can hear their pulse in their ear, I don't automatically think this could be something bad like a stroke.
Gentlemen?
There's one kind of classic diagnosis that any ear doctor would be very familiar with, and it's called a glomus tumor or a glomus tympanicum tumor. They're fairly rare, but particularly if you have just one-sided symptoms that's new and significant, just a simple exam usually can rule that out. Hearing your pulse or other sounds in your ear suggest a conductive hearing loss, a problem moving sound through the system. Moving sound from the eardrum to the inner ear. Things like fluid, just eustachian tube dysfunction. Really simple things can cause it. And but if it's one-sided and significant and a dramatic change, it should be looked at for that.
Yep. Yeah. So I believe it or not, in ear, nose, and throat clinic, I've diagnosed carotid stenosis on patients, and get a little stethoscope and listen. And occasionally it'll lead to some imaging too if we're not certain. But yes, in most cases it is a benign situation.
Med school, they always told us to put your stethoscope up there and listen, make sure you might hear it too, so it's worthwhile. Snoring. You guys involved with snoring? Who does the most of that? Todd, you're leaning into the hardest.
Yeah, I think.
What causes it?
Well, snoring is a palatal sound. A lot of people come to us thinking, well, if you fix their nose, we're going to fix their snoring, and that's not always the case. The really critical question that you need to ask yourself or your spouse or your family member is not if you're snoring, but if you're breath holding when you're sleeping. Because what we really want to differentiate is the simple snorer from someone who has obstructive sleep apnea. Obstructive sleep apnea that's untreated and unmanaged has dramatic increased complications of heart disease and arrhythmias and stroke and accidental death. And so sleep apnea, definitely we want to try to identify that. In children, we tell parents to watch their kids for regular 10-second pauses in their snoring where they're making respiratory effort but not moving air. And same with adults with their spouses. If they're seeing them breath hold and make respiratory effort without moving air, that's something that needs to be evaluated further. A lot of the snoring and sleep apnea workups kind of cross lines between ear, nose, and throat, and neurology and pulmonary medicine, and any of those can kind of be entry points for evaluations of that problem. But yeah, even kids through adults, if there's a difference between simple snoring and snoring with obstruction of the airway.
John, anything more?
I think that was well covered.
What can a person do, as long as we got you on the spot, what can a person do for ear pain while flying? That's a good question. It's a lot better since they started the slow descents in the old days.
Yeah, absolutely. So, one does have to consider whether you're rising, ascending, or whether you're descending, because that determines which way you should be either blowing or actually pinching your nose and swallowing, because the pressure will be different as you're rising as opposed to when you're descending. But let's just presume it's when you're descending and you have relative negative pressure behind your eardrum. You can try to yawn. Basically, you can try to swallow. You can do things to try to cause the muscles to open your Eustachian tube. There's a commercial device which is a valve that someone can put in their ears that I think anecdotally people say works well for them. I have no personal financial interest in ear planes, but that is an option. And believe it or not, there is, for people who have classic sort of pain like this, there's a relatively new FDA-approved surgical device for this. In particular, there's a Eustachian tube balloon. So if people have the correct story and they're flight attendants or something like that, or business travelers, there actually is a surgical option for this problem in the right circumstance.
That's good to know. I did not know that. Thank you. Addie, ringing in the ears, what's the cure?
That's one of the hardest things.
And what is it? I guess that would be the other thing.
Sometimes we don't know. It's called tinnitus, and sometimes we don't know the cause. Sometimes it has to do with certain inflammation of the inner ear or the nerve involved with that. Sometimes it just happens, and it can happen in, I believe, in hearing disorders as well, just as something sort of benign and very annoying and uncorrectable in that situation. So it really depends on whether you have hearing loss associated with it and other symptoms that may indicate that there's something going on with the nerve.
What causes itching in the ear?
Too much Q-tipping.
That's true.
But among other things, it can be irritation of the skin, too much dryness, too much moisture.
Yeah, or even fluid in the ears or fluid shifts in the ears. People will complain of itching.
Itching is just a mild form of, it's a mildest form of pain. It's triggering those nerves, so it implies inflammation or some irritation, and there's a whole bunch of different causes for that.
What causes vertigo? Somebody jump in.
stimulation of the inner ear and the absence of movement, sometimes due to viral conditions, sometimes due to benign small crystals floating in places in the inner ear where they should not be.
Person wakes up with a lot of phlegm in their throat in the morning.
Mm-hmm.
An older person.
They live
Me,
in northern Minnesota.
in northern Minnesota. Is that a normal phenomena?
I would say by and far, yes. And it's probably the most frequent thing people bring up to me during physicals.
Yeah, what I tell people is your average human nose produces about a quart of secretions a day that has to go down your throat and swept to the back of your nose and down your throat. And as we get older, those secretions thicken up. There's really only 4 things you can do to help that. Lots of extra fluids, eliminate caffeine, saltwater irrigations in your nose, and Mucinex or guaifenesin to break up mucus. And it's not a disease, it's just changing physiology.
We're almost out of time. Can the neti pot give you trouble with your ears?
No. You can never put too much salt water in your nose.
Very good. Thank you. I want to thank our group tonight. This has been a very interesting evening. There are a lot of questions that we didn't get to, and I'm sorry about that. But I do want to thank our panelists, Dr. Todd Freeman, Dr. Jonathan Glickstein, and Dr. Addie Licari, and our medical student volunteers on the phones, Ryan Kolakovic, Rachel Hoyer, and Peyton Schultz. Please join Dr. Alan Johns next week for a program on cholesterol problems when his panelists will be Dr. James Conniff, Dr. Victoria Heron, and Dr. Jason Wall. Thank you so much for watching. Have a great night.